Let me introduce myself. I'm Dr. Keith Williamson. I've been the medical director here at Midwestern State University for more years than I want to say, 20 years. I got my medical license. When I got my medical license, Ronald Reagan was president, and the #1 song on the radio that day was Bad Medicine by Bon Jovi. So it's all very portentous here. But we brought you here today because there's this topic that we need to address. And Stephanie Baker actually got this all started because she sent me questions. She said, I've got a lot of questions in my classrooms about the safety, and some of these questions they're seeing online about the vaccine. So I'm going to start out here. The vaccines are safe and effective, and I bet we end up there too. Currently, according to AMA surveys, 96% of physicians are immunized. Now that was kind of a small group that they surveyed, but physicians have bought into this. They're kind of the inside traders in this, and they know what they're looking at. That's what they spent their lives studying to do in both basic science, biology, chemistry, then the pre-medical education, the medical education, and then practical applied medicine in residency. They know what they're looking at. Now there are a few doctors out there who didn't get immunized, and a lot of them go online and make a big fuss and get a lot of attention. They're the outliers in this whole group. And then there's Nicki Minaj, and I'm not going to try and explain that. So the question that we are really interested in hits me in where I live, because I do college health, and my patients, 99% of them are men and women in their reproductive age. They're either thinking about starting a family in the future, or some have already got a family going, and they don't want a vaccine to disrupt that, and that's the question. So we asked you for questions earlier when you had time to think about it and put something together in a thoughtful and reflective manner. And so that's where we're going to start. And I've brought friends in. You guys have heard me talking for at least 20 years probably, and you're tired of hearing me talk about it, and I've got some real experts here today that can talk about these issues as well. So they are Dr. Pruthvi Patel, family practice, yay, I'm family practice too, and Dr. Jamaan Kenner, who's an OB-GYN. And I would like you to introduce yourselves in your own words. Pruthvi, why don't you go first?
I am Pruthvi Patel, family medicine at URPG. I actually recently graduated from residency. Victoria, Texas is where I studied. I started back in December, early December, so it's almost been a year since we've been here. And I then went on maternity leave in February. So I've had my kid. She's a pandemic baby. She's 8 months old now. Scared of people, scared of noises, scared of everything. But I did get vaccinated while I was pregnant. I got both of the vaccines while I was pregnant. And originally, like many of you, I was skeptical because it was new. I was pregnant. I was scared. I was like, man, if I get a fever, you know, fevers are known to be dangerous in pregnancies. But then I thought about it. I was like, COVID is life-threatening in pregnancy. So I was like, let's just go ahead and do it. And with the help of Dr. Kenner here, you know, he helped me, and all of the OBGYNs there kind of answered a lot of my questions, which was nice. And then later I was like, well, my pregnancy brain was like, I don't know what was going on. It was pregnancy brain. And then I was like, let me think in doctor brain. And then finally I got my vaccine. I got both of them. It did great. Baby's great, thriving. So yeah, that's me.
Dr. Kenner.
My name's Jamaan Kenner. I'm an OBGYN over at URPG. I started last July, so I've been over here just over a year now. And from New Orleans, I did my training out there. And so my big reason for getting vaccinated initially is, honestly, I was just scared of contracting COVID. When it first hit last year while I was a resident, there were a lot of patients getting sick. It was just really triggering for me. And so super excited about when the vaccine actually came. And so my whole thing was, especially in the beginning, was what am I more scared of? This low chance of a potential side effect from a vaccine, or we know bad side effects coming from COVID. And so that's what kind of made the decision for me, and now trying to get out of this pandemic and into normal living again.
Thank you, and I've got you on the spot now, so I'm going to ask the first question to you. And that is, without the ability to conduct studies on long-term effects, Why is the COVID-19 vaccination recommended for pregnant women and for those planning to become pregnant?
So, as you said, the college that we follow, which is the American College of Obstetricians and Gynecologists, and then there's also the Society of Maternal Fetal Medicine doctors, who are high-risk doctors, basically. And both colleges recommend COVID vaccinations in pregnant patients, patients who want to be pregnant, lactating patients. And so, again, there's no long-term data, right, because the vaccines, they haven't been out a year yet. But at the same time, it's been shown that pregnant women who contract COVID-19 are at high risk for severe disease, requiring an ICU admission, requiring intubation. And so there's also only a few vaccines in pregnancy that you can't take. And those are the ones that are live, or where the vaccine gives you some portion of the actual vaccine itself. And it's not because of potential risk or damage to the pregnancy itself. It's because pregnant women are immunocompromised and they're at an increased risk of getting that, whatever the vaccine was for, because they're immunocompromised and there's a chance of it converting. And so these vaccines that we have aren't those, so there's no real reason to think that you're going to have any issues, because there's no other vaccine out there that's really causing any issues.
Really good. So you stay up. So what evidence is there to prove that the vaccine is safe when it comes to fertility? Is the answer true for all versions of the vaccine? I don't know how I feel about those absolute questions with absolute truth. What do you think?
So nothing in medicine is absolute. Nothing's going to be 100% effective. Nothing is going to work for everybody the exact same way. And so in terms of safety regarding fertility, one, there's no real reason to think that it's not safe for fertility, because there's no vaccine known that has caused issues with fertility. And there are some small studies where they looked at women and men, and there was a study about in IVF pregnancies. They looked at patients who had antibodies due to COVID infection, antibodies due to COVID vaccination, and no antibodies at all. And there was no real difference in miscarriage rate and infertility or inabilities to get pregnant. There was also another small study in men where they looked at the Moderna and the Pfizer vaccines, and they looked at sperm count, motility, and things like that. And it also showed no real difference. And so we don't have a big study looking at all of these things, but based on these little studies and based on things that we've known in the past, then there's no real reason to think that it's going to cause any issues with fertility.
Dr. Patel, I'm not going to leave you out. So this question is for you. Are there potential lasting effects that the vaccine could have on me, my fertility, or future child?
I think Dr. Kenner kind of pointed at that. There's no known lasting effects for infertility. In fact, there might be beneficial ones, especially as, you know, there's actually a CDC V-Safe registry that everybody gets asked to register for. So when I was pregnant and I got vaccinated, I registered for it, and it takes a lot of the data after the vaccinations, like what were your side effects, what were your, like, how long did your side effects last, did you get your second vaccine? They even remind you to get your second vaccine. And then after about like 3 months, when my daughter was born, they actually called me. CDC called me personally, and they asked me about my pregnancy. They asked me how my delivery went. They asked me how my daughter was doing. And with that data, they actually gathered that fertility was no different than pre-vaccination, vaccinated versus after even their second vaccination. There was no increased risk of miscarriages. They actually said that even after after the first dose, they had about 5,000 people say, hey, I'm pregnant now. So the data is actually showing that there's no lasting effects on infertility.
Yeah, I see so often these questions are framed like, is the vaccine worse than my perfect health when I was 25 years old, 10 years before the pandemic? And that's not the right way to look at it. It's, how is it going to be worse for me with the disease or with the vaccine? And I think that is exactly what you were pointing out. Yeah. Very good. Back to you, Dr. Kenner. So, have there been any pregnancy complications reported that point to the vaccine?
Not that I've seen in my year and a half dealing with COVID. I've actually been on a thing of where I'm trying to make sure that my patients, or at least advocating for my patients to get to get vaccinated. And all my patients that have been vaccinated, everything's been fine. The only real side effects that some people get are the fevers, the chills, for about a day or so. And that just means that the vaccine is working itself. So I haven't seen anything or any issues where they can point it out going to the vaccine.
Very interesting. Dr. Patel. Is immunity passed through breast milk? Is this safe since COVID inoculation is not currently recommended in children under 12?
So, I guess that's a twofold question. The first question, so breast milk, I don't know if you guys know a lot about breast milk. Breast milk is ever changing. A lot of babies, they recommend breast milk because we get antibodies through breast milk. A lot of immunity is passed to the fetus or baby at that point through breast milk. And it's ever changing to what you see. Now, vaccinations, in terms of the COVID vaccine, the antibodies have been proven to actually transfer through breast milk. A lot of moms are actually trying to relactate now from like 3 months of not being, having to breastfeed their child because they want to take the vaccine and then provide that antibodies, those antibodies through the breast milk to their child that aren't able to get the vaccine. So there's been a lot of people trying to do that. It's a very hard thing to do. But the studies have been showing that antibodies are passing through breast milk, which is good for those that are still, breastfeeding. My instance, we're still breastfeeding even at 8 months. And she has been in contact with people that unknowingly have been COVID positive, and she's done great. We've done great. We haven't gotten sick. She hasn't gotten sick, so I definitely think it's working. And the second question, Pfizer just released that the data for 5 to 12, I believe it is all positive. They're thinking they can send it to the FDA for that age group to be approved for the vaccine. So there's been no issues in that age group. So 5 and above, I think are going to be greatly benefited from that. And I think the 1 to 5 year old, they're going to work on that. I actually have a friend that her kid is actually 3 weeks younger than mine, and they are working on studies that she wanted to get her 8-month-old into. So they are working on studies in the younger age groups. They're just hoping later on this year we'll get some data from that.
So you're saying that the vaccine doesn't go through the breast milk, but the secretory IgA that you create after you've been vaccinated passes through the breast milk and is protective for your child. I think that's a good thing. So at this point, we are through our questions. So we get to throw it back out to you, and hopefully we've at least stimulated some thoughts in your mind and other things that you might want to ask about. And while we are focusing especially on fertility issues and child rearing, I would open it up to whatever crosses your mind that you might have concerns about. Your turn. Yes, ma'am.
So I would have, what is y'all's opinions on the Pfizer's effect towards birth control? Specifically, hormonal birth controls versus non-hormonal, like the copper IUD versus the pill. Mm-hmm. And do you think it would actually affect the effectiveness of that, or maybe even the effectiveness of Plan B or something like that?
So I don't know 100%. Right, but yeah. I wouldn't think so, thinking of the way that the vaccines work in producing antibodies and then the way that your birth control works. So the things that would really affect the way that your birth control works is whatever is going to metabolize whatever that hormone is, right? And so don't have any real reason to think that anything with the vaccination would change that. There has been some changes with women's cycles after they've gotten the vaccination, and that's all immune mediated. The same thing happens when women get sick, right? And so that's the only real big change that I've seen or that I would think possible. So no reason, in my opinion, to think that would affect it.
Thank you.
So are there other questions, please? Yes, sir.
Mine's not so much about fertility, but it's about the boosters. What is the projected efficacy of them versus someone that's just had, say, the 2 vaccines already? And I just was curious about how that was going to work.
I guess I'll try and tackle this one. So the question is, what is the role of boosters? Is it going to boost our immunity? Do we really need to do it? Have I got that about right?
Well, yeah, I'm just saying, like a lot of people are getting the virus now anyway after having the 2 vaccines.
Yeah.
What is the benefit of a booster if you're still going to potentially get it anyway? Is it just a risk of the actual effect of the disease, or is it just? I mean,
right. Why do we need a booster at all? So, and the FDA was discussing this just yesterday or the day before, and what you're seeing is they're basing their recommendation, those who are in favor of a booster, all they're looking at is the IgG levels, the serum antibodies, and they do fade away, as they do for everything after you get a certain amount of time out from your initial exposure to either the disease or the vaccine. That does not mean that you haven't developed T cells and B cells, that cellular mediated immunity, that are there to remember and to respond next time you're exposed. So there are some who say we don't need boosters at all in immunocompetent people. They're perfectly capable of taking care of themselves. Also, you're seeing both reinfection in people who've already had the disease and breakthrough infections in those who are already vaccinated. And this is expected. It is a low but true positive that some people will break through or get reinfected, but they don't get as sick in general. Unless when they got that first shot, they were so immunocompromised they didn't really respond to it in the first place. So yeah, I don't think boosters are for everybody, for a targeted group of people who don't respond as well. Yeah, 65 and older, maybe for healthcare workers, because we're exposed a lot more than other people. So my policy right now is pretty much you have to be at least 4 months from your initial series and have to have some reason to need a booster. Yes, ma'am.
In my experience, whenever a lot of my coworkers and I got the vaccines, a lot of them experienced really severe symptoms or side effects with the second vaccination. Do you think with the booster vaccines, we'll see a lot of people struggling with a lot more than you would see someone who's on their initial vaccination?
So I think the question is, does a booster shot for any of the vaccines cause more side effects than just the second shot of a series of 2 shots? Mm-hmm. Anybody want to take a shot at that?
I would say, I guess it depends on how you look at it. Because I don't know the actual data of who got more sick, if the people get more sick after their first shot or after their second shot. So what I would think clinically is that people will probably get more sick after their first shot because you're building a more robust response as opposed to you got a response already with your second one. And so if I'm just reasoning through it, this is like no data at all, I would think your third shot probably would cause you the least amount of symptoms. Mm-hmm. But that's just me thinking about it, not 100% sure.
It was just personally entirely based on my experience.
Yeah.
Because I work in healthcare, almost all my coworkers, were they in an older age bracket, or if they'd had COVID previously, their second shot wiped them out for 2 to 3 days. Whenever their first shot, they had 0 response. Mm-hmm. So I'm interested to see how the booster will affect them.
Anecdotally, that is exactly what I've seen. The second shot is hard. I probably have more experience with boosters than the other doctors in this room because at the end of August, I had 450 vaccines to throw away. They were expiring August 31st. So I said, this was right after President Biden announced that we were headed towards boosters. If you want a booster, come get it. And I did treat a lot of elderly people. I treated Presbyterian Manor Nursing Home. And a lot of the healthcare providers from the hospital came over, and that was real interesting and fun. I see all these names, I never meet the faces, but the experience I would anecdotally relate with boosters is it is worse than the first shot, not as bad as the second shot. Anecdotally, it's worth what it's worth.
Well, thank you.
Mm-hmm.
So the booster's pretty much the same thing as the second shot then?
It is identical.
At what point does the vaccine card cross the HIPAA line?
At what point does the vaccine card cross the HIPAA line? You mean if you were required to show your card, is that a violation of?
To go into a restaurant.
Right. Does that violate HIPAA rules if you have to show your card to get into a restaurant or a concert or anywhere?
To fly.
Or to fly? And the answer is, unless they're electronically billing you, HIPAA does not apply. Now, other privacy concerns might be ethically considered otherwise, but that's not a HIPAA violation. Now, the state of Texas has mandated there will be no vaccine passports. And so it's a whole different kettle of fish here, and we're all eagerly waiting up with popcorn to watch the politics evolve around this. It'll be interesting to see how it all sorts out in the next few months. Yes, ma'am.
So does the side effect after the second vaccine mean that the vaccine's working? That doesn't mean like if you don't have the side effects, it didn't work?
Anybody got any articles on that?
Not off the top of my head.
Okay.
I didn't get any side effects. Well, I lied. For my first one, I didn't get any side effects. For the second one, I just got a sore arm. And I was pregnant. I was fully immunocompromised as a pregnant patient. But, I mean, I think I've been around patients that have been positive. I've worked the COVID tent. I think I've been around enough positive patients to kind of say that I'm doing fine.
Yeah, I gotta say, I talk out of both sides of my mouth with this, because if you have a lot of side effects, I say, don't worry about that. That means your body is reacting, and I'm trying to make them feel better. By the same token, if they have no side effects, I don't know of any evidence that suggests they're not having a perfectly adequate immune response.
Pertaining to your patients that you see, how many would you say received the COVID vaccine prior to getting pregnant?
So the question is, in my experience, with my patients, how many have gotten vaccinated prior to pregnancy, right? I really just started asking, because I got to think about where they're at in their gestation, and because I just started asking, I would say probably not that high. And so probably like my military people and my medical people, probably more so than other people. And when I ask, okay, COVID vaccine, what do you think about it? Have you gotten it? And then why not? And so the vast majority of the questions I've gotten, of the answers I've gotten for why not is, I don't know, I'm not sure. I wanted to ask you about it. And so to really answer your question, if I had to make up a number, maybe 20%?
Gotcha. Yeah, it's still really new. So,
Yeah.
Yes, ma'am.
So would you all recommend that pregnant women receive the booster shots since they're,
So the question is, do we recommend that pregnant women get the booster shots? And so, in my opinion, it's going to depend on probably when you got your first vaccine. I think you said 4 months since your last is what you were recommending. I think it's kind of a wishy-washy at this point in time because we don't really know, because they still haven't really recommended the booster for any people other than those that they listed as to be immunocompromised. But I mean, if you take in that rationale, then yeah. But it's just a conversation that I would have with my patients, and kind of what they decide is what they end up deciding.
I'm fortunate to have access to smart PhDs here on campus, and I talked to the virologist, Dr. Mazuoka, and I looked at the local data, and I landed on 4 months, because when there is a breakthrough or a reinfection, it occurs between 4 and 5 months on average. So I just said, well, this is as good a reason as any to choose a time. Very good. More questions? I mean, you've got this brain trust over here. Take advantage of it. And this is really great of you to come by and talk to our students here, because you guys really are in positions of authority, and you're busy too, obviously with family. All right. Oh yeah.
Just how would you describe the COVID vaccine to other vaccines that not attack similar viruses, but attack similar, like what would you compare it to, I guess?
Yeah, what would you compare this new vaccine, this brand new vaccine, to that we have familiarity with, like DPT, MMR, and so forth? Anybody want to take that on? I have ideas because this is such a cool technology. What we're seeing, and part of why it's gone so fast is, when I was in medical school, they were in the middle of the Human Genome Project, and it took years to get the first human genome traced out. Now they can do it overnight. I mean, you send your spit into Ancestry DNA and they have it. And we've made a huge amount of progress in genetic and molecular biology. This enabled us to both identify the virus, sequence the virus, and propose a vaccine within weeks of it being realized to be a problem. Then they were able to, they had the problem of getting it logistically into production. I'm talking about the mRNA vaccines in particular. And once they were able to get it into production, they overlapped in a logical and logistically successful way the phases of the studies. And the one brilliant advantage they had was with a lot of new vaccines, if you were making a vaccine with Ebola, that's a rare disease. This was not a rare disease. It was all over the place and everybody was at risk. So it was able to accumulate those numbers really quickly. This is what propelled this vaccine forward so quickly. There is nothing to compare to it in the previous structure of older vaccines, but I bet you we see a lot of the older vaccines reconfigured to be an mRNA or adenovector viral vaccine, because this is just such sweet technology.
I think Pfizer's actually working on a couple different mRNA vaccines out there. So
yeah, this was not new technology as everybody's thinking. They were working on it. And in fact, of course, we got our first look at the SARS-1 virus 20 years ago when it came out in Korea in 2002. So this was not a surprise.
I would just be curious if you all would just say, bottom line, most important thing regarding fertility, the vaccine, what you want somebody to know. Like, what are those few sentences, whatever it is.
I'm going to go with my old standby line. The vaccine is safe and effective. It has zero effect on fertility. This came out of a letter complaining to the European Union about the vaccine studies, and it was nonsense. But people, for whatever reason, don't like new things. They don't like vaccines, got hold of it, and have managed to bother and worry, a lot of concern, to innocent people in their reproductive years, because this is a core issue to your identity. So it's nonsense. Safe and effective.
I would echo the same thing. And so there's a lot of misinformation that's going on about the vaccine, about everything, right? You have Twitter, you have Google, you have all of these different things. And then it's a lot of different people who are able to get their opinion across. Some people who aren't necessarily or shouldn't be qualified for said opinion, but it's a big thing and a lot of people attract to it. And so what I would say is, for people who are skeptical about anything, vaccine included, is that you find your doctor that you trust, find you a medical professional that you trust, go to them with your complaints or whatever questions that you may have, and then make an educated decision based on that. Not necessarily the big headlines and things like that, because the majority of those things aren't going to be true.
I triple what they say, obviously. But I do want to add to that, if you do have questions, especially infertility, am I gonna grow a tail? Just the weird things that I've heard. I've heard some pretty weird things in family practice about the vaccine. And it's frustrating sometimes because all the data is available. CDC website has everything. They link it to the websites, the trials, they do their VSafe registry. They do. I mean, CDC has a lot of information, whether it's breastfeeding, infertility, side effects of the vaccine. But do your due diligence and find a reputable source, not Facebook, not Twitter, not your grandma that is against vaccines. Like, it's be very mindful of who you trust in especially with the COVID vaccine, and ask questions to your healthcare professionals, especially someone that you trust. Find someone that you trust, and then just, get your vaccine. Just do it.
So any other questions? I'll go back to rounding up and ending for the third or fourth time. I don't recall. But what a great thing that you had questions and were willing to talk to us. It only took us like 45 minutes to get you comfortable to talk to us. But the way I look at it, I'm getting right back to where I started. The vaccine is safe and it's effective. And the only way, this pandemic has disrupted everything. School, the economy, going out to eat, all over the world. And the only way we're going to get out of this pandemic is with immunity. There are two paths to immunity. You can do the disease route and have so-called natural immunity, or you can get the vaccine. And the way I look at that, it's like you're stuck on the 4th floor of your building and the elevator's out. You can jump out the window and take the natural course. Gravity will get you down to the ground floor really fast. You may not survive, you may have some injuries, but you got there. Or you could take the stairs. It'll be slower, and you may be sore for a day or two, but it's much safer. That's the way I look at it. Take your choices, and now I think I can trust you guys to be our ambassadors, and I would emphasize speak with zeal and authority, but also with kindness, because people get so offended when they're told what to do. That's doesn't work for me. All right. Good? Thank you guys so much.
Not a problem.